What if we could detect virus outbreaks before anyone steps foot in a hospital? At the University of Michigan School of Public Health, researchers are working to do exactly that by listening to what goes down the drain. In 2023, the Michigan Public Health Integrated Center for Outbreak Analytics and Modeling, known as MICOM, was established with $17.5 million in funding from the Centers for Disease Control to create faster, smarter outbreak analytics tools. MICOM monitors viruses shed in human waste to alert public health officials in real time.
We track a wide range of different pathogens from the flu to measles in the wastewater. So when you use the bathroom, if you're sick, you shed virus or pathogen into the waste, and that goes to the wastewater treatment plant. And by tracking that, we can actually keep track of how much activity is there for flu or RSV or norovirus or any number of other things that it would be hard to track otherwise.
Samples flow from the lab into automated data pipelines, feeding MICOM's public health dashboards faster than any emergency room report ever could.
We translate that information so that people can use it to understand more about their world. So we both make the data more accurate, we make the data faster, and we also make it easier to interpret. We find a lot of context in the data so that people can understand how their day-to-day life is affected by these different pathogens that might be there in the community that we're picking up.
When a spike appears, health departments act, and MICOM tracks whether those efforts are working.
And so that's one of the ways that we use wastewater. It's like these pathogens of public health concern that are not reportable, because we can actually follow these over the course of the year, right, in a way that we probably didn't have that idea before. It allows us to better resource and prioritize that particular case with many other things that public health has to do.
But MICOM isn't just about raw data, it's about making it useful through modeling, forecasting, and collaboration with officials statewide.
It's been great just to have these partners in MICOM and Emily and Marissa. Not every health department has that opportunity and luxury, right? So to be able to work with such great academic partners and sort of great thought leaders, right? And so I feel that has been something that's been really helpful for not just sort of us, but also kind of broader Michigan.
We're building it in a broad way, and we're building it in a way that we can be agnostic of what virus or what bacteria that we're worried about, so that if something new happens, we can immediately shift our focus and start responding and giving people information right away.
So it really is sort of an invisible shield that we're, most of the time, if things are working the way we hope they will be, you don't even know it's there.